Well, good evening, everyone. This is Tuesday, the 24th of October, 2023, and I am Dr. Ellithorpe, and we are at Tustin Longevity Center, where the TLC Health Freedom Tribe, I guess, is what Mr. Uh, one of those gentlemen named it well, I guess it's been over a year. But anyway, the uh, list today is a little bit more manageable, and I do have the 3 or 4 I didn't get to finish last week. Remember, we're doing this for educational and support purposes. This is not meant to be individual management or advice over the YouTube, but we're a functional group of medicine where you can ask me anything you would like about questions on healthcare and how would a integrative functional doctor deal with this. I've had 42 years of practice, and before that, working with my father in food research. So I have, half a century of this background of natural medicine. So it's fun to look at lifestyle and the challenges we have living in a processed food world and how to make these better choices. We here are doing this every Tuesday at 6 o'clock. You can invite your family and friends. If this is of value to you, of course, we hope that you would hit the like button and share this with family or friends. And then we have on the live group, for those who are live watching, you can type in on the YouTube a question and I will defer there if I see one of those come up. And or you can get an email if you're on our email list, tlcdoctors.com, and then get notification of when our next YouTube will be. And we'll try and go ahead and get all these questions answered as soon as we get to our next week's visit. So I will begin with our email questions because I don't see any in the live chat. And these first three are from last week that I did not get to. And the first one is Debbie says, my husband was just diagnosed with ankylosing spondylitis. Do you recommend anything aside from anti-inflammatory drugs, which of course have long-term side effects? And the answer, Debbie, of course, is yes, because ankylosing spondylitis is an autoimmune disorder. The blood type matters, the digestion, and the chronic lining of the gut here. Here's a healthy lining. Here's where you have holes poked through. Food lectins, viruses, chemical assailants, high glucose, excess sugars in the body. All these things inflame the gut lining, and with that inflammation there on the cell membrane, you're going to have this chronic inflammation leaking through the gut, elevating the alert level of your gut-associated lymph tissue. And then you can get some molecular mimicry where some of the inflammatory molecules will see the cartilage or bone and material that creates the ankylosing spondylitis. So working with your specialists, if you would have your husband see a good functional doctor, get a complete digestive stool analysis, and then have him get food allergies done, the immunoglobulin G, which are not the E, which is the immediate hive producing anaphylaxis type, but get the chronic slow allergy reaction, the IgG. And in the meantime, I would try and put him on a very simplistic diet, a one menu day, protein rich with only cooked vegetables. And those vegetables would be the low carb, fiber rich ones. And the only condiments I would use would be salt and pepper. And then I would completely get away from all the grains and anything that is called dairy. Remember, what you call dairy, I call white fire liquid, and what you call cheese dairy, I call white fire bricks. because homogenization and pasteurization turns the natural milk and the natural cheeses into a fragmented, inflamed combobulation of molecules that are abnormal. So all grains and dairy should be out of the diet completely. Then I would go on the systemic enzymes like Vitalzyme or Vascuzyme. I would use 5 twice a day on an empty stomach. I would heal the lining of the gut with the phospholipid powders and a good probiotic. I would use a good multi-mineral and a good B vitamin with vitamin D that has K2 in it. That would be the core approach that I would bring. Now there's curcumin, there's many other things that could be talked about with your functional medicine doctor. Even EDTA chelation will quickly enhance the microcirculation and disinflame the body by better circulation. And that goes without saying. His water use has to be half his weight in pounds as ounces every day, and he should never eat late. That's how I would begin, Debbie, and it works every time. What damage is there can be mitigated, and maybe eventually you'll be able to discontinue the anti-inflammatory drugs that they may be giving them, or at least reduce them. Nicole says, I'm having body pains again after recovering from a virus 2 weeks ago. Anyone else experiencing these issues? Well, Nicole, there could be all kinds of items going on here. What are your other general state of health issues? Are you a normally very healthy person? What is your weight? What is your age? What is your work environment? What is your blood type? What is your background as far as allergies, seasonal allergies? The allergies are that we're in. This is the season of pollens and harvesting. The other thing is, what is your zinc level? What is your vitamin D level? So all these things, Nicole, have to be addressed by a good functional medicine doctor to kind of put this together. So it could be allergies after you had a weakened state from the virus you had 2 weeks ago. It could be just from your age or your general health or other health issues. So all those things have to be brought into mind. And so, yes, as a doctor, we do see patients who will have a viral illness, start to get better, and then they can have some myalgias, aching muscles, and fatigue. And we can usually sort that out. But do see your doctor. Bettina says, I have a girlfriend that has shingles. What do you recommend she does for the itching and the pain? How long does it usually take before it heals? Do you only get it once, or could it come back? Um, Shingles is the old chickenpox virus, varicella, that is in the dorsal ganglion of your spine. It lives there. And as long as we take very good care of our health, keep our immune system functioning, then the suppression of those old varicella chickenpox viruses will not crawl out along a dermatome. And normally we give high-dose vitamin C, intravenous vitamin C, which acts as an antiviral. We spray the surface of where the lesions are along that one side of the body where the track is for the dermatome comes out with Argentine silver to prevent secondary bacterial infection. And we use high-dose systemic enzymes for the inflammation and reducing that inflammation and the pain associated with it. We make sure that the patient stays cool and dry. And then we make sure their vitamin D level is up. We would probably have a check and have them use 50,000 international units of vitamin D3 for 5 days, and then drop back to about 10,000 a day thereafter. We would give them supplemental zinc. Zinc then in the form of TLC multiminerals, and we would have them take 3 a day because zinc works as a antiviral. And we would give them high-dose quercetin to help the itchiness and the reduce the viral expression. Quercetin works as a ionophore, just like the ivermectin and hydroxychloroquine. These help the cell membrane to be crossed, to get over that cell membrane and allow the zinc to get in, and then the zinc will suppress viral replication. We like to do the high-dose vitamin C maybe once every 3 days or every other day at the onset for a week or two, just pounding at it with natural vitamin C. That shortens the time span. Now, the lesions that show up on the skin are just like any scratch or tear or bruise or burn. It's going to take weeks to heal until a new layer grows out. But to prevent this in the future, you have to take and work with a good functional doctor, checking your D levels once or twice a year. Whether or not your insurance covers the payment, I think it is valuable and should be covered. But nevertheless, those of us who care about our health, we want to take that and make sure that D is in the 80 to 100 range. And we want to make sure that we're on good zinc and we're on low carb, because the carbs lower the immune system and allow viruses and stuff to attack us. But that's hopefully answering your questions, Bettina. Carolyn says, are you familiar with thymosin alpha-1 peptide treatment for used for autoimmune disease like rheumatoid arthritis? Is there any downside to peptide therapy? It would be administered under the guidance of a functional medical doctor. Thank you. Yes, there is a whole field of peptide therapies emerging. I just came from a course on this 2 weekends ago, and we are exploring the use of it here as well. So this peptide therapy has merit, but I don't have personal experience with this yet. But there's great excitement over the things that signal our DNA, that signal fellow cells to behave, stem cells to revive and become active, to repair skin, to repair bone, to repair muscle, to repair brain and nerve tissue. Everything is spoken to through the cell membrane. That's why I have done publications on the cell membrane. And these receptors, which are the proteins embedded and floating in this membrane, are signaled to by peptides. These are small amino acid chains of various configurations that dock with these receptors on the cell membrane and tell the cell how to behave, or a message it wants sent to the nucleus. And so peptide therapy is one of the new exciting areas in functional medicine. And yes, I'm aware of it. And yes, it looks exciting, but I have to do more studies on it. Now, is it safe? My understanding is yes, it's very safe because you're dealing with natural things. But I am saying that conditionally because I have more reading to do it, like I need another hole in my head. I am involved in so much. Functional doctors have to read and study and study and read and read and study, and we're not paid for this. And so we love our patients, we want to benefit them, and of course we want to help our families and ourselves. But this is such an exciting new area, and we're trying to stay on top of it. We're trying to do things like this to teach our patients and to make things available, keep you updated, and let you know that we are staying updated. So I would say, Carolyn, we're excited about this, and it looks like a very promising and safe therapy. Holly said, hello, just learned that my iron saturation is elevated. your iron was 184 and the percent saturation 77%. I tested negative for hemochromatosis and do not take supplements. Is there anything I can do to resolve this naturally? Well, Holly, are you a menstruating woman? Are you postmenopausal? Do you ever donate blood once or twice a year and give a pint of blood? Um, are you inflamed? Has anyone checked your mineral status? Are you eating out of iron cookware? Is your glassware glazed with iron in the glaze? These are various things that I would be asking, Holly. Fortunately, an iron level of 184, although it is elevated, I think 150 is the upper limits of normal, and 50 is the upper limit of percent saturation. So this is not out of control. And work with your doctor. Look at your environment to see where the iron might be coming from. And our multivitamin TLC Energy Core does not contain iron. We ask our patients to eat enough red meat, which normally will give the iron that you need. But work with your doctor. Those are some suggestions and framework that I would suggest to you. But go donate your blood, and it would be very beneficial. Susan says, we are considering solar panels on our roof directly above our bedrooms. What health research or advice do you have that may impact health with a mini power station on our roof? I don't think that there's any issue with the solar panels. It is having a power emitting radio frequency that I think is of concern. And so the bio collection of light photons into the cells on the solar panel is just a electron transfer, not a signal. And so I don't think that's a problem at all, Susan. Danielle says, what can help with both fibromyalgia and losing weight? Well, all kinds of things. Again, you should see a good functional doctor and look at the degree of inflammation in your body. Look at the degree of cell membrane capacity to repair in your body. Remember, if you are in America and they have been frightening you from eating meat and fish and egg yolks and chicken with the skin on it and butter, these are all rich sources to have a healthy phospholipid, bilipid membrane and protein and area for your receptors. And we get injuries just using our body every day. Even your mitochondria, the batteries inside the cell, are working, and they have the same membrane, and so does the nucleus. It has the same membrane construction. And if you have 50 trillion cells, and each cell has maybe another 5,000, 10,000 of intracellular organelles with membranes just like that, do you have any idea how much healthy fats and essential fats that you need to consume? And so I think all this processed hydrogenated fats has destroyed America's actual structural building of your cell membranes. And I attribute, some of the slowness of my aging and my endurance to the fact that my dad had us eating Armour Food Research meat all the time. And he would never let my mother use seed oils. And we had butter. He would never go for margarine. And so I think I have the cell membranes that represent more of a person who would have been born in, the late 1880s, early 1900s, who only was eating these healthy fats for a healthy cell membrane. Remember, if I couldn't do this video with you if I didn't have a good roof, I didn't have good windows to block the sound. And if it started to rain or a bird flew in here, we would lose our connection. You would be distracted. You would maybe see the water would hit the computer and it would blow a fuse. So the structure of the room I'm in is as important as having knowledge and sharing it with you, and you with me with your questions. So please understand that you have to have a healthy structure to your human body. And your cell membranes are a sensory device, just like your eyes, your ears, your nose, your mouth, and touch. All this sensation is communicated through these little proteins that are floating in the membrane. See, like in this picture over here, this big thing glob right here is a membrane. That's a protein being held in place by these two bent triglyceride, lipids. This is the alpha linolenic acid and linoleic acid through the double bonds there. And we are not eating this, and you are being fooled into taking EPA and DHA all the time. And what you really need is linolenic, alpha linolenic, and the phospholipids and the cholesterol to have healthy cell membranes and structure. So you're going to be more easily damaged. And if you have fibromyalgia, that is a syndrome complex of symptomology without any one known cause. They speculate, is this chronic low-grade Lyme's? Is it a chronic low-grade viral illness? And so when they ruin the food and they do industrialized farming, your zinc levels, your magnesium levels, your vitamin D levels are blocked by all this chemtrails and the nanoparticulate heavy metal toxins that diffuse into the stratosphere to bounce away the very light waves that you want to hit your skin to help you convert your cholesterol into vitamin D. So you have all these things going against you. That's why you need doctors who are functional medicine, who are looking at many other aspects of your situation. So with fibromyalgia, if you're inflamed and it's chronic virus, it's toxins, it's too much sugar, it's too much hydrogenated fat, it's not enough phospholipid repair, too many holes in the membrane, you have to work towards and with your functional doctor to help improve that. Possibly you would need to resupply natural hormones, possibly the high-dose vitamin C intravenous therapy. Certainly the enhanced circulation for delivery and removal of these toxins with EDTA chelation therapy would be a very valuable thing to do. Taking anti-inflammatory enzymes, not eating late, starting to exercise, all these things matter. And the doctor who will look at your fasting insulin, look at your hemoglobin A1C, look at your triglyceride level, and look at your fasting blood sugar and hold you to a higher standard than the reference ranges because they're too liberal and they keep everyone sick, fat, and happy. So that's what I would say, Danielle. Okay. Laura Lee says, in a recent YouTube, you had mentioned how blood type A had some exceptions than the other blood types. Could you speak more about why and or what are some of the other exceptions with it be food supplement tests? Well, in general, we're all fearfully and wonderfully made by our Lord. But there's certain liabilities that we have found, and in the blood type A, that liability happens to be in the fact that A-type blood as a class of people is found to make less digestive enzymes. So if you're eating food, let's say a steak or an egg with the yolk or some butter on something, your ability to have enough enzymes to chop up and eat, break up the protein in the steak, the protein in the egg, the fats in them and in the butter is hampered. Therefore, you'll not feel well when you're eating these very rich, nutrient-dense foods, and you'll learn not to eat them. And then you'll move toward becoming a vegetarian, vegan, because it's easier, much more simple to digest carbohydrates. Therefore, you're going to wind up having higher blood sugars and insulins and hemoglobin A1C and fasting blood sugar and triglycerides, all these kind of things. So we tell blood type A, please just take a digestive enzyme like orthodigestzyme. That's what I use, orthomolecular products, orthodigestzyme. We have it here for anyone who wants it as digestive enzymes on our private label, because ortho will only sell to physicians. And if you take that after you eat, that will probably solve all your problems. And it's my understanding that if you look at all the gold medalists throughout the years, if you find out what their blood types are, the most greatest performance in athletes hold Olympiads are blood type A. So that's all I'm saying. You know, B's, I'm a B type blood. B's have their liabilities. ABs have a mixture of both the A and the B. O's have their liabilities. We all have a cross to bear, and you have to find a doctor who is sensitive and open to learn about these things and to use these simple measures along with understanding the blood type of their patient. So let's see. We have Amela says, "Hi, Dr. E. Hi, Amela. Is D-Hist supplement better absorbed on an empty stomach, or should we take it with food?" I don't think it matters, Amela. I've used D-Hist for over 35 years, close to 4 decades. I think it was the very first product that Orthomolecular ever came out with, Amela. And it is a wonderful quercetin-rich natural antihistamine and very good for allergies and things like that and preventing viruses and succumbing to them. And I have never seen a difference whether I take it with food or an empty stomach. I personally take it on an empty stomach. Hope that answers your question. Christina says, "Hi, Dr. Rita. I hurt my right foot recently, the top tendons and the bottom under the big toe. What can I do to help them? Thank you." Well, it depends on, how bad the injury. If it's just something you banged it with and you bruised, it should totally heal. But I mean, if you had a sharp, blunt item, you might have some micro tears or even tendinous, or may even need a bone x-ray for your foot. And recently, how long is recent? Some people would say 3 months ago is recent, or a week ago is recent, or yesterday is recent. So you need to have a doctor look at this. But in general, we're designed to heal. Written in the DNA and sensed by all the cells, when there's a injury, the fragments of that injury are sent out in the area and picked up throughout also the whole body. And that generates messages to send repair material, more blood flow, and white blood cell to protect against infection. And that redness and pain is just a signal from the fragmentation there. So water helps, fasting, not eating anything for a day or two, and then your whole body will focus on the source of where the injury is. Taking systemic enzymes 5 or 6 twice a day will reduce the inflammation. And but I can't examine it through something. If it's serious and lasting, you should have a doctor x-ray or look at it yourself. But that's what I would suggest. Let's see. Now the next one here is from Kathy. Kathy says, "Hi, Dr. E. What causes cataracts besides aging? Is there anything that I can do to prevent them from becoming worse or even improve them, reversing them? Thank you." Cataracts, the reason why I have this picture here is this is what happens at every place and site in your human body that's hurting, whether it's a gunshot wound, okay, whether you get a big amount, or you just had a little virus penetrate through the cell membrane, or you're dehydrated, but cell injury is all the same. And so your lens is this kind of jelly-filled ball right behind the pupil of your eye that dilates. And what it is, this clear gel film has the little muscles on it on each side to squish it together, which helps you with your near vision, or thin it out, which helps you with your distant vision. And so this is going on without thinking autonomically all the time. If you look far and you look near, and you look far and you look near, and those little muscles themselves can get worn out, just like your muscles in your arm. Plus, if you have a lot of sugar in your diet, a lot of food allergies in your diet, if you have a lack of water in your diet, if you have low-grade chronic infections in your diet, if you're not getting enough of these phospholipids to repair, then what will happen is this beautiful gel ball will get kinks in it, okay? And the little structural proteins in it will start to oxidize, burn, you might say, combine and link up. Even sugar will glycate and create these little dark spots. Plus, that's what causes floaters. So, antioxidant assay, taking powerful antioxidants, and I use the Juice Plus series for this. I'll take the fruit, vegetable, and berry, and I have for closing on, I'm getting near to 30 years on it. And I take enough water. I am always working to drink half my weight in pounds as ounces of water every day. I do aerobic workout. I do my weightlifting. I take my systemic enzymes to disinflame. I do chelation to improve the microcirculation. I try never to eat late at night. I try and eat very low carb. And then I take the vitamin A rich supplements, both in the Juice Plus and other antioxidants, lutein, zeaxanthin. All these are in the Juice Plus as well. So look at a lifestyle of doing these things, pulling out oxidizing heavy metals, lowering the sticky, gummy, clogging up sugars, trying to eat a simple diet, drinking enough water, taking enzymes. I think that's why at 70 I don't have cataracts. Hopefully that helps you, Kathy. You have to do it all, okay? Jenna, part 1, I have been taking your TLC metabolic formula for over a year now. My last hemoglobin A1C was 6.2. I am working through food choices and exercise to get it into the normal range. I do intermittent fasting from 8 p.m. until 1 p.m. the next day, several days a week. So you must end your eating at 8 and then you don't eat until 1 the next day. I have been taking 4 of the TLC capsules with my first meal fasting. Blood sugar has been around 100 to 149. Part 1. This must be part 2. Okay, part 2 is, should I still take 4 TLC metabolic formula capsules at the same time when I have my first meal of the day? My fasting blood sugar average is too high and I want to get it closer to 100. It's anywhere from 100 to 149. What changes can I make to get it lower? I will not take pharma meds for this. Well, you need to exercise. You need to do some weight training because your muscles have the units to help burn down sugar. I would do weight training twice a week, bare minimum 20 minutes. Also, I would do brisk walking 20 minutes the other day. So 5 days a week, I would walk as fast as I reasonably could walk and still have a conversation. But every 2 minutes, 3 minutes, I would spurt that walk for about 20 seconds as fast as I could, and then come back down to my good pace and recover my breath for 2 minutes, and then 20 seconds cycle up almost breaking out in a run. So this is walking with spurts. Every about 2 to 3 minutes, you do as fast a short of running as you can for just 20 seconds. This is called high intensity training, and this is very valuable, and it stimulates your mitochondria, which will help you burn your sugar. And you have to do the pull against weights to build the containers of your muscle to burn up the sugar. Along with your good intermittent fasting, I would take 1 day a week where I would go from dinner to dinner. I would skip that eating at 1 o'clock and make it till dinner at 6 p.m. And I don't think I would eat till 8 o'clock. I honestly would shift this to eating from noon to 6 p.m. because the later you eat, the harder it is to lower your blood sugar. But that's what I would do. And then let us know how your numbers are here in a month or two, and share with your local doctor, and keep an eye on this and make sure that you're being monitored. It sounds like you are because you had a hemoglobin A1C. We would like to see that get down to 5.2, and it will if you do those things. So do a 24-hour fast, and do a earlier cutoff on eating. Do the exercise with the brisk walking if you can tolerate it. I don't know your personal situation or age, but these are the things I would say in general to my patients who are able to do these things and don't have some other mitigating factor. Linda said, I have had a retinal detachment and 2 retinal tears in the other eye. How do I help my eyes and get rid of the floaters? Also, what is the best natural cure for anxiety? I have severe anxiety. Well, exercise really is one of the best natural cures for anxiety with weight training. So the very same thing I just told Jenna about weight training twice a week, and with heavy weights, not to the point where you're popping your eyes out, or straining, but having reasonable hard resistance in a real formal situation, not some 5-pound weight or 10-pound weight, where someone is going to help train you. I use the perfect workout, and that's where I go 3 times a week, and that's where I'll be tomorrow morning at 6, 7 in the morning. Okay, and so the other thing I would do for that is got to have enough water. You have to have enough water to help the eye pressures and the flow of fluids in and out. And if your eye and your whole body is getting older and drier and wrinkled, that's how it can shrink away and pull and get the detachments and so forth. Plus, you have to work on your membranes. You have to have your structural repair with the actual fat and protein that we're made of in your eyeballs and your retina, and the cell membranes back there are made of that. So to make them resilient and supple, you have to be eating these things. Fruits and vegetables are not what you're made of. I would take systemic enzymes to disinflame your body. And the other thing is, when I had a big floater one time, I don't know, it was about 1.5 years, almost 2 years ago now. And I just woke up with it one morning. I forget what time of year. I'm under stress all the time. So, but stress can precipitate this. It can push you into some poor habits. And I tend to think this was in a January time frame or a Christmas season where I was imbibing in too many treats during a holiday season. But anyway, so I went on a 5-day fast. Now I can do that. I worked up to it. I don't know where you are, Linda, but when I saw that, I immediately stopped eating for 5 days. I just had water and black coffee. And I tell you, that thing dissolved tremendously. The inflammation in my body tremendously dropped. I took all my vitamins. I took extra enzymes. I pushed my water to the limits. I walked and walked and kept my work up, kept my exercise, weight training, and Pilates up. And that sucker just dissolved away down to, I don't know if I can see it right now. I would say it's 95% gone. And that's how you have to live your life. You have to live it, doing all these things, especially as we age. But see your ophthalmologist and have those things managed also appropriately. Chris says, "Hi, Dr. Ellithorpe. Thank you for all you do. I have had bad breath for years and it's affecting my social life. I brush, floss, and have no cavities. I've noticed when I'm nervous, my breath seems sour. Could this have anything to do with stomach acids?" And that's the very thing I was going to bring up, Chris. The acidity in your mouth and saliva is very much associated with the type of flora and the bacteria that are in your mouth. There is a product out there called, what is it called? Bright Power. I think it's called BRITE Power. Anyway, it's a tooth gum. You use one a day, and it has in it calcium carbonate, it has lysozyme, it has mint, it has myrrh, it has in it, what else is in it? I can't think of the other 2 items. There's 6 items in it. But xylitol, it has xylitol in it. What's the last one? I can't think of the last one that's in it. But anyway, this dental gum mint helps change the pH of your saliva, helps your enamel and the dentition, helps even prevent cavities. But it changes the flora fauna in your mouth. And usually the breath is also cleared up. That's what I would try. Another thing you could do is take that Argentine silver. Argentine silver we have here is called Argentine 23. There's 23 parts per billion of nanoparticulates. So it's a very uniform, dispersed thing, not colloidal, clumpy. Although colloidal silver is helpful, but I like the nano particulate, and that works very well too. You can take a teaspoon at night, swish and swallow. But I've heard good things and have had some people and dentists talk that Bright Power, which is the calcium carbonate, lysozyme, mint, myrrh, just like the wise men gave at the birth of Jesus, the frankincense and myrrh, MYRRH, I think it is, the xylitol, and yeah, that's what I would try, Chris. Marilyn, I've seen some recent research that indicates there is a distinction between carbs in processed food as opposed to naturally occurring in foods. True. Which indicates that the carbs that naturally occur can enhance fiber intake and other benefits. Yes, there's good science on that. I also wonder if the naturally occurring sugar in fruits and other fruits shouldn't be distinguished from. Well, the thing, Marilyn, is, there's a lot of natural occurring starch in a potato. There's a lot of naturally occurring starch in a carrot, in a pea, in a corn, in a bean. But the thing is, they're genetically modifying so much of this, and even the apples today are not like the smaller apples that were more tart 50 years ago or 60 years ago. So they're messing with everything. And we already have hurt ourselves with a too high of carbohydrate exposure. So being aggressive as you can, because we're not made of fruits and vegetables, we want to use these phospholipids and get our house and our cells and our eyeballs and our lens and our retina and our brain and all our tissues much better covered with the phospholipids. But yeah, the natural occurring starches, fruit sugars, carbohydrates in unprocessed fruits and vegetables, nuts and seeds are far better than any processed food by 1,000%. Yes, I totally agree. But if your fasting blood sugar after not eating 12 hours is already 95, well, that's too high. And so every carb matters. If your triglycerides are over 100, then that's too high, and every carb matters. If you're fasting insulin after 12 hours of nothing is over 4, then that's too high, and every carb you eat matters. If your hemoglobin A1C is above 5.2, then there's a lot of sticky sugar in your body, and adding more carbs doesn't make sense. Donna says, what does the comment partially visualized 1.4 centimeter right lung vaguely defined ground glass abnormality means? It means you have to go to your doctor who's going to look at that and decide, knowing all about you and who you are and what your symptoms are, should that be biopsied or should that just be re-imaged in a period of time, months, or so. That's all that means. It means that radiologists really can't tell you what's going on, and they're not your doctor. They don't know you, so they want to cue in your doctor that though they see something vague about 1.4 centimeters, which is really less than an inch, and it is vague. Then you just have to follow it up and work with your doctor and see what symptoms led you to get the original imaging study in the first place. This was commented at the bottom of a CT scan of the lung. Is that something to be concerned about? Well, talk with your doctor who knows you and your background and why the original CT was done, and then you have to decide then. So in general, it can't be said anything more. I know you want an answer, but you have to work with your doctor on that. Dorothy, what are the symptoms of arthritis and effects? What are the most effective things for reversing it? Well, it's joint pain, joint erosion, lipping. So wherever there's chronic inflammation in a joint, then the micro injuries are occurring, and then it's recurring and recurring, and very often calcium deposits will recur to try and cement it down, try and plugging the holes. So that's why we're very much against allowing chronic inflammation to go on, like inflaming your liver with alcohol every day, or smoking cigarettes inflaming your lungs every day, or not walking to get your hydraulic pump rinsing out your blood, so to say, with a daily walk. Any inflammation will call for repair. And when that repair is not done, then you're going to get the body's attempt to repair it, and then eventual calcium being laid down. Therefore, you want to eat a low carb diet. You want to have good water in your body. You want to have good enzymes, because we lose our enzymes with aging. You want to have that walk regularly. You want to not clog up the capillaries with food allergens and a lot of sticky sugar. And so all these things work to make it better. But you see how this picture applies to every disease in the human body? And this is what they need to teach the doctors out there. This is what they need to teach. All right, Cher says, I have been seeing your doctors at the center. I am on progesterone and estradiol patch. Do you believe in bioidentical hormones made from compounding pharmacy? What's the difference between these drugs? Well, estradiol is estradiol, and that's a biochemistry, three-dimensional configuration of hydrogen, carbon, and oxygen. And that molecule in a special form is called estradiol. And that's the only kind a human woman makes. And that's what we give. Now, pharmacies package this and put that molecule sticking to a patch that you can apply to yourself, and you absorb it at a certain rate. They can put it in a pill and you can absorb it, or you can put it in a cream and you can absorb it. So these are the most common ways, and they're bioidentical, and we can measure it. So I'm in favor of it. I'm not in favor of synthetics that are copycats and have similar uh, um, behaviors as the estradiol, but might be too much. For instance, Premarin was from equine sources, horses, and so the structure of the estrogen in a horse is different than a woman. So we believe here in using only natural uh, hormone replacement therapy that's human bioidentical. And you'll just have to talk with your doctor. Progesterone, there's only one molecule of progesterone, biochemical stereotopic arrangement, and that can be sold to you as Prometrium. That's the trade name that the pharmacies use. Compound pharmacies will often mix it in peanut oil or olive oil, and they will call it progesterone capsules. They will mix it with a cream and make it progesterone topical cream, but it's all wonderful, natural, bioidentical. So yes, and we do this here. Let's see, we had another question here. Let's see, Jenna says, thanks, Dr. Rita. Having my yearly checkup next month. I will implement all of your recommendation. I am 56. Okay, there you go. And Jenna, part 3. Should I keep taking all 4 TLC metabolic capsules at the same time each day, or 2 in the morning, 2 in the evening? Thanks. And may the Lord continue to bless you. Thank you for your prayers, Jenna. And we certainly need them here because lots of things are going on, and we just need the protection of God's holy angels so we can take care of our patients. I take my TLC metabolic formula in the morning all at once, and so I don't think it makes a difference at all. And I believe in keeping life simple, so that's what I would say, Jenna. And then Carla says, Dr. Rita, is there any way that I could have a long distance consultation with you? Carla, I would call the office and tell them your situation. And the reason why there's difficulties is malpractice is putting parameters on who I can see, what state or what not state. So that's what's going on, Carla. There, and I am trying to raise up doctors here. It looks like we will be taking on another wonderful doctor with some good experience already. Tremendous internal medicine lady doctor. I'm very impressed with her, and she's really eager to continue to grow and learn. But she comes with great skills already. But you know, we're not the only ones. If you go to ACAM, the American College for the Advancement of Medicine, ACAM, acam.org, and look them up and wherever you're at, Carla, and find a doctor there. Call the office, find out a little bit about the doctor, how long they've been actually practicing what they call functional integrative medicine. Ask them if they do chelation therapy, IV to remove heavy metals. Ask them if they do high dose vitamin C therapy. And then if they say yes to that, bioidentical hormones, and are they familiar with doing special food allergy testing, complete stool analysis? If that is yes, 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 we do all this, then it sounds like that might be a good place to start, Carla. So I'm not the only one, and I'm still learning, and it's fun to learn. I love being a student, and my patients teach me so, so much as well. All right. And then we have Manja. Manja says, hi, Dr. Ellithorpe. Is there a natural way to get rid of a urinary tract infection? Well, the answer is no. If you have a bacterial cystitis, you have to use an antibiotic. And I don't like fooling around with infections where they ought not to be in the body. Now, we use Uratrac and cystatin these are two supplements. One is a D-mannose, which is a sugar you can take orally that is not absorbed in your body for energy, and it stays in the, it's absorbed and goes through the kidneys and into the bladder, where it helps make it the environment very unlikely for bacteria to attach to the lining of the bladder and urethra. So that's D-mannose, and that's called cystatin. And then we have cranberry extract, which is called Uritrek. And cranberry extract is helpful also in inhibiting bacterial overgrowth. But drinking enough water, keeping it low carb, having good hygiene around and after sexual intercourse, these are all very important things. So that's what I would suggest. But if you think you have a bladder infection, I would do a nice clean catch. Make sure you wash well and really hold the lips apart so the urine is shooting right out the urethra and not flapping between the lips and the hair. So we get a true clean catch and get true facts about what your bladder urine is looking like, not what the skin and hair looks like on your lips, because it's then a contaminated sample. And I've seen too many people get on antibiotics because the front office girls will not, they are embarrassed to talk about these things, I guess, about the lips and the hair and holding them apart. But you've got to do it. Otherwise, you get lousy samples, and lazy doctors will just treat any white blood cell. And your skin is full of white blood cell. The hairs are full of white blood cells because you can culture off of any part of the skin. All right, Carly says, hi, Dr. Ellithorpe. What are your thoughts on using Dihexa, PRL 8-53, or Noopept alone or synergistically for Alzheimer's patients? Thank you. Carly, I am not familiar with those. Dihexa and then PRL 8-53 and Noopept, Noopept. These are new things, and they may be takeoffs on the new peptide theory craze that's being taught around, because I know these other doctors are starting to look into the alternative functional integrative world, and peptide therapy is where it's at. But it'll be far better if the patient gets on hormones, if they can, gets EDTA chelation to improve the circulation, and the low carb diet and enzymes and exercise and those kind of things as well. But I'll have to look into that. Let me make a note on that, because my patients are always helping me to grow. That is Dihexa, Dihexa, P capital R capital L -8-53, and capital N lowercase OOPEPT, and that's for Carly. So wait till next week, and I should have that looked up by then. All right, so please, folks, if it's possible, pray for us. And if you are benefited by this, please like and subscribe. Please leave a comment in the section, even if it's just a thank you on the end of this, because comments on these things help circulate this. And maybe we can turn this into a supportive income source. Who knows? But like and subscribe, pray for the clinic, and we pray for you. And thank you for sharing with us. And I hope God blesses you all. All right, take care. Good night.